or, once you open up blood flow, the garbage that may have collected in tissue will wash out. You might have seen this. Have you ever been training somebody? Within about 6 minutes of when they open up, you smell all this yucky stuff coming out of their breath.
Stinks. Yeah, you can smell chemicals. It almost smells like if somebody were painting the room. Or I had a patient describe like smelling her mom's perfume that she hadn't been around for a decade or more, but like that smell started coming out of her breath, her skin. So yeah, without a doubt, you're opening up detox pathways.
So if we talk about the little brownout areas, what happens is the vascular system chokes off and blood stops rolling through there or flowing through there. When that happens, anything that gets trapped in that area basically stays there because the flow that would normally carry it out is blocked. Okay, so when people go on LiveO2, we're talking about, well, how come we smell this weird stuff coming out of their breath? Well, what happens is when we break through, we reestablish the flow, and all of the garbage that's collected in that browned out tissue washes into the bloodstream. So as the heart pumps stuff, that garbage in the bloodstream will go back, circle through the lungs, and if they're volatiles or things that want to go into a gaseous form, when that blood flows through the lungs, it'll go into the air in the lungs and you'll blow it out. So when you're working with somebody and you smell them, blowing off DEET, mosquito repellent, or paint, or perfume, what you're seeing is that, wow, whatever tissue that stuff was in had been locked offline or choked off or browned out since whenever it was when that material got trapped in there.
Right, since they were exposed, probably.
Well, just like in the example, you're talking about the person's like, wow, that's my mom's perfume. She's been dead for 15 years. Well, the tissue that opened up to release that had been browned out for 15 years.
Wow. Imagine the potential, right? Because where was that? What if that was in the kidneys or the liver, some vital organ? I guess it probably adipose tissue as well. But if somebody's trying to lose weight, then wow, fantastic. We're really opening up all of these organs or potential places where it could be stored and getting that all that potential, right? Like all of these cells have jobs to do. And if they're browned out, they're not doing them.
Well, okay, so if you go into those little brownouts, so, this odor phenomenon is really kind of it's a door to a really deep well in physiology. So if you imagine a region of cells that's browned out that, blood can't get to, well, there's 3 or 4 problems with that. The first is they're not going to be able to do their job. The second is gunk or toxins are going to accumulate there. The third is these cells are going to be isolated from the immune system because blood can't get close. The fourth is because they're living in an anaerobic environment, they're going to be acidic. Okay, so they're going to age fast. If you're going to get a disease, you're going to degenerate here. All right, and if you're going to get, I'll call it cell reproduction defects that eventually result in diseases like cancer, guess where it's going to happen?
Yeah, right in that spot. There's so much potential benefit here. It's just incredible. And it almost seems too simple, right? Because all we're doing is using these physiological parts of the body that already exist. We're just enhancing them.